Unical Radio International, Entertainment 360, Edutainment 360, Infotainment 360. We smile like that.
Good evening, listeners. Welcome to ABC of Health with Dr. Thelma. And today we're going to be tackling the topic epilepsy. So today we're talking about the truth about epilepsy, the whole truth and nothing but the truth. So with me in the studio, I have Dr. Torti.
Yes, that's correct.
I spent 3 minutes learning how to pronounce the name. You're welcome to the studio, sir.
Thank you. Good evening, listeners. I'm glad to be here.
Okay, good. And we're supposed to have a special guest on the show from Asindi, but he's unavoidably absent. He sent in his apologies and has promised to be with us some other time. Okay, so quickly we'll get on to it with Dr. Torti. Okay, so I'd like to ask you, what exactly is epilepsy?
Thank you very much. Epilepsy is one of the commonest neurological diseases. It's a neurological disorder characterized by tendency to having recurrent seizures. And all of us must have heard about seizures one time or the other, commonly called convulsion. And a seizure occurs when there's abnormal electrical activity or excessive electrical discharge in the brain cells. So when someone has a tendency to be having recurrent seizures without fever, it is epilepsy until proven otherwise. And when there is this electrical discharge, the way the brain is wired, the brain is connected and communicates in electrical connections called neurons. So when there is any abnormal discharge or firing, the manifestations could be in terms of abnormal behaviors, abnormal movements, and the common one that we know that the general public is used to is jerking of parts of the body. It could be the whole body, it could be part of the face, it could be other parts of the body. It could also be in different other ways. You can be talking with somebody that has epilepsy, and all of a sudden the person stops and starts staring into space or staring at you. Maybe blinking, maybe having some free movements of the mouth. After a few seconds, the person fully recovers without being able to remember what happened in the time in between. You can also have another type where the person just, what we call drop attack. The person just loses muscle tone and falls down. And after some time, he gets up. So it can present in different forms and different ways. So there are different types based on how it presents.
Okay. Thank you, Dr. Torti. Well, that's an elaborate description. Okay, so what are all convulsions epilepsy? You just described, you talked about the types of convulsions or seizures. Are all of them have epilepsy? In essence, what's the difference between someone that has a convulsion and someone that has epilepsy?
That's a very good question. Not all convulsion is epilepsy. Convulsion simply means that there is an electrical discharge in the brain that manifests in abnormal behavior or abnormal body movements. We commonly know that children, when their temperature rises, when they have fever, they can convulse. It doesn't mean they have epilepsy. Somebody has infection of the brain, which may be present with fever, convulses, headache, becomes unconscious. It doesn't mean that the person has epilepsy. There are other things that can change in somebody's metabolism. Even having low blood sugar, it can convulse. But it becomes epilepsy when there is an enduring predisposition due to a particular disorder in the brain, such that without provocation, without having fever, as in the case of a child, without having an ongoing infection, the person convulses and can continue convulsing once in a while. So, in that situation, the person has epilepsy.
Okay. So someone can actually convulse or have an episode of convulsion. That necessarily is not epilepsy. However, when it becomes sustained, repetitive, and occurring without any maybe trigger of fever and all that.
Yes.
Identifiable triggers like fever.
Exactly.
Yeah.
When you have more than one convulsion that is not triggered by some of these things that I've mentioned, 24 hours apart.
Okay.
It could be one convulsion today without fever,
Mm-hmm.
and another 3 months after, or 6 months after, or even a year after, is epilepsy.
So it's not epilepsy. So much sorry. Okay, so at what ages can people have epilepsy? Is there like a distinctive thing, like is it for children or adults or the elderly? What age can people have epilepsy?
The bad news about it is that it cuts across all ages. Anybody can develop epilepsy.
Okay.
An infant can develop epilepsy. A newborn that has what we call severe Bartter's.
And then that's another one, and then it becomes epilepsy. Is it
Yes,
possible?
it's possible.
Okay.
It's possible, but the one that is more common is when such an adult maybe has a head injury or develops a central nervous system or a brain infection or has a stroke. Subsequently, that person can develop epilepsy. But it can also happen in an adult for the first time, just develop without in adults. But it's more common developing earlier on in childhood.
Yeah. Okay. That's good. Thank you. All right, sir. And I need to ask, this epilepsy we're talking about, you mentioned something about febrile convulsions, and then all that. But epilepsy in itself, is it infectious? Like, can it, like somebody has epilepsy and you're living in the same house with him, are you going to get epilepsy from him? Can it be transmissible, like from one person to another?
That's a very good question for the public to know. Epilepsy is non-communicable, it's not contagious. Touching somebody that is convulsing, you cannot catch epilepsy.
What's in the person's saliva touches me? There's this other thing about people saying, don't let it happen. What's the saliva
That's one of the myths
Yes.
that everybody listening today should pay great attention to, so that we become ambassadors to disseminate information. Because usually, when somebody convulses in the public, everybody takes off, everybody runs away. So it's part of a way of discriminating and stigmatizing those who have the disorder. So it's important to know that even if the saliva of the person that is convulsing touches you, you don't get epilepsy. Epilepsy is a disorder of the brain. It's not something you can get through even the blood of the person. It has a contact with you. You can't get epilepsy, but you can get other diseases from the blood.
Not epilepsy.
They're not epilepsy. It's something in the brain.
Okay. Okay, sir. Thank you. So, can epilepsy be inherited? Like, the father had it, the son is going to have it. Someone in the family had it before, that's why you're having it. Can it be inherited?
This is one of the common questions we have sometimes when we make a diagnosis of epilepsy. Parents will say, but there's nobody has it in our family. In the greater majority of the cases, there are other identifiable causes. It's just a small percentage that is genetic that can be inherited from father to parents to offspring, or that can in the family, maybe an uncle. But in most cases, there are identifiable causes, and in most other cases, generally, you may not be able to identify the cause.
Yes, I'm even coming. Okay, that brings us to our next question.
So it can be inherited, but it is a small percentage.
Okay, so it can be inherited. Okay, sir. So just tell us about the causes of epilepsy, since you've already gotten into that. The causes of epilepsy.
Okay, you know I have a bias for children.
Yes.
So I will start from there.
No problem.
When a child is born, we expect the child to cry so that air goes into the lungs, circulated with blood around the body, especially the brain. If for any reason, maybe the woman has been in labor for a long time, the baby comes out asphyxiated, that's what we call it. The child is not crying at birth. That child will develop what we call cerebral palsy. And part of the symptoms that present in those that have this cerebral palsy would be epilepsy. If a child is born premature and the child comes very early, part of the problem they may develop as a complication of prematurity would be epilepsy. Then, infections of the brain. We have meningitis, viral encephalitis, and the likes. Part of their long-term complications is epilepsy. Then head injury. A child may have a fall or even an accident, hit the head on a surface, bleed into the brain. Long-term complication. Then there are other ones too that are not so common with us, like some abnormalities in formation of the brain, what we call brain malformations. When a child develops brain tumor, so all this can lead to epilepsy.
Okay. All right, shortly before we go ahead, we have to give out our phone number so you can call and ask questions. Like we always say on the show, you can ask questions basically pertaining to the topic we're discussing. But if you have any other questions that you think you want to ask the doctor in the house, you can also ask. So the number to call is 080 94 44 40 59. I'll take that again. 080 94 44 40 59. And I'd like to remind our listeners that today we have 10,000 naira worth of airtime up for grabs. At the end of the show, we'll be asking questions from what Dr. Torti has been telling us on epilepsy. And the correct answers, the first correct answers via WhatsApp or SMS to this same number I called will win the 10,000 naira airtime. And that won't be just one 10,000 airtime, it's 2,000 naira across 5 people. So you have to listen and be ready to answer the question. Okay, Dr. Torti, we talked about the causes of epilepsy, and I want to ask. I know initially when we started, you already started talking about the way epilepsy presents. What are the symptoms of epilepsy? Like when we have malaria, we have headache, fever. When someone is living with epilepsy, what are the symptoms the person will have?
Thank you very much, Dr. Thelma. Epilepsy is such that most of the time is the people around the person that has it that will tell the person what it passes through.
Okay.
There are different types of epilepsy, and the way they present, the commonest generalized epilepsies, it could be stiffening of the body. You notice that all of a sudden, the person becomes all stiff, stretching of the body that can last a few seconds to minutes. It could be jerking of the body. That is very common. The whole body becomes stiff and starts jerking, and the person's eyes are all rolled up. You're not seeing the dark parts. Saliva coming out from the person's mouth. Some of them, they can pass urine or pass feces. And it can also occur the one we call focal seizures. Parts of the body is involved. It may just be the eyes. Sometimes it can be so subtle that if you're not quite attentive, the parents, especially for an infant, the parent may not know that the child is convulsing. The child may just turn the head to one side with the eyes deviated, fixed at one gaze.
Wow.
If you wave your hand in front of the child, you can't call the child's attention at that particular moment. It could also be one part of the body just twitching. Then another type of generalized epilepsy. The generalized epilepsy is that when they occur, the person is not aware of the environment, cannot remember what happened in between. You may be talking with the person, the one we call absent seizure. The person stares in space as if he's absent-minded. And after a few seconds, that one doesn't last for long. He now regains himself. Then there are other ones too. The person can just fall down, stays on the floor for a while, he will not jerk, comes up again. There are other ones too. The person may just be behaving abnormally. The person may just be rubbing his face repeatedly or fiddling with his button or fiddling with his clothes or walking endlessly. That one also lasts a few seconds. All of a sudden, the person regains himself, may not remember anything that happened in between. So these are the things that can present as epilepsy, and it's important for the caregivers or the family members to record what they see. They may not be able to explain it. Record it when you come to the hospital, you'll be able to classify the epilepsy.
All right, so the caregivers or the family members should record. I know we have digital phones, so it's easier. You can just take a video, make a video of whatever symptom you see, and then okay. All right, so then, is there treatment for epilepsy?
Yes, epilepsy is treatable. And there are different modalities of treatment. There are medications. There are a few cases the person may need surgery. There are a few other cases, some implants can be implanted into the person's body to control some nerves to reduce the seizures. But most of the time, drug treatment. And the drugs are such that you should be taken regularly. You don't miss the medications. Timely and regularly, because the aim will be to control the seizures, to achieve a control. And achieving a control means that while you're taking the medications, you're no longer having seizures. And most of the time, we aim at achieving control for 2 to 3 years, depending on the age of the patient, after which we gradually withdraw the drugs. And for a lot of cases, we keep observing them for another 5 years, then you'll be discharged. Most of them will not reoccur, but in some percentage, up to about 35 to 60%, they may also reoccur. So it's treatable.
So this treatment, like you mentioned, are they tablets, are they syrups, are they what you call it, injections? What formulations are there?
There are formulations both for adults and children, for most of the medications. For the children, to be in form of syrup, then they are syrups. Then for adults, they're in form of tablets. And I mentioned earlier that for some of them too, they may take it for life. Some people may need to take it for life. But the good news is that while you're taking it, you're seizure free. You go on with your daily activities. A lot of people have epilepsy, but they won't know because they're on their drugs. People from different professions, teachers, doctors, academics, students. Yes, I have colleagues who have this condition, but you will not know. They have their medications and they are fine.
Okay. Is there anything that determines those who have to take the drugs for life and those who have to stop and exit after a while? So what determines that? Is that like a cure? So when do you say there is cure for epilepsy or it can be cured? So that's what I'm asking.
For those who we can actually control, and at some point we withdraw the drugs and they don't have the epilepsy again, of course we can turn that one cure because they don't have any recurrence. But on some others, there may be a need, especially those who have a particular identifiable cause in the brain for which it will be unlikely that the seizures may not stop totally when the drugs are withdrawn. Such people may have it for life. Children with cerebral palsy, children who have done one form of surgery or the other, children who have identifiable particular lesions, if I may call them that way, in the brain when we do a brain scan. So part of what we do, especially if you have one part of the body that is involved, especially maybe people who have stroke. If you have had stroke, the chances that it will reoccur when you start medication should be higher, because there's an area of the brain that has really been severely affected. So you need to keep on with the medications to keep suppressing that area to make sure that it will not become a focus of additional electrical discharges.
Okay, so now we've talked about epilepsy. You told us it can be a cure, and for some people, it's got to be long-term control. I want to ask, what are the complications of epilepsy? Why are we worried? I mean, why would we want to be bothered about epilepsy? What are those adverse things that can happen in people that have this disorder?
Yeah, thank you very much. I would like to talk about the complications in this way. It will depend a lot on how frequently you have seizures.
Okay.
If it is somebody that has seizure once in a while, it will not have so much effect on the person. But by the time you're convulsing regularly, depending on the type of seizures that you're having, it has a way of affecting the brain and the personality of the person involved.
Okay.
Even from sustaining injuries, because when you have a seizure, generalized seizure, you fall down, and you're not aware of the environment to control how you fall.
Okay.
You can hit your head on the surface, on the hard surface, you can have burns, you can have injuries. Most of the time, when they are bringing people for the first time, especially from the villages, one thing you notice is you see bruises, marks of injuries here and there, and that can even complicate the problem for the person, and they develop head injury and even have more problems. And when you're convulsing to an environment that you have things that can be harmful to you, let's take for instance, you want to swim, and people are not around you.
Okay.
If you convulse, possibly you can drown. But other complications with uncontrolled epilepsy, for a growing child, you may have difficulty learning because this is the brain we're talking about, especially visual memory. You may have problems remembering things. You can also, over time, develop from the way you're treated. That's one of the reasons why we want to raise awareness, don't stigmatize them. Don't stigmatize them, don't discriminate against them. Some people may develop depressions, anxiety disorders, and the likes from being stigmatized, the way the society looks at them. Then you can also have complications that come from the medications themselves. We know every drug is a poison, but we're taking the drugs because the benefits outweigh the risk. So depending on the type of drugs, some of them can make you drowsy. And especially for those in school, if you're on such medications, you may discover that you may be struggling in class to stay awake and to keep up. So all these are addressed. You make alterations here and there. You interact with the teachers to make sure that they monitor them, make sure they cope with learning. So, and the other one too, there are certain things that can happen. You can aspirate when you're convulsing. Aspiration means that things like saliva can enter the wrong way and find themselves into the lungs. And part of the reasons why we have something like sudden death in epilepsy, somebody can convulse, and the part of the convulsions, the other parts of the body, including the heart, the nerves that control them, can overfire. And the person can die, but these are things that are not so common. So the thing here is control. If you put the person on medication, take them regularly, the incidences of other things that will come as complications will also reduce.
Okay. All right, so that's well noted. Okay, all right. So now, let me ask this question. You've explained what can happen in people that have epilepsy, even children, learning difficulties and others. So this would be a good time to ask, can people living with epilepsy live normal lives, live up to their optimal potential? Can they pursue their dreams? Can they be doctors? Can they be engineers? Do you understand?
Yeah.
Do they have any limitation whatsoever because they have epilepsy?
You can pursue whatever you want to do, but at some level, for you to get certified in some jobs, you may need to be seizure-free for some years to reduce the risk that comes with that particular job. Like being a pilot, like being maybe engineers that climb heights. You need to be free.
Because you can't have a seizure while flying a plane.
Or when even driving, you have to be seizure-free for some years to have your license to drive as an epileptic. But of course, with medications, you can achieve all the seizure freedoms and live your normal life and achieve all the possibilities.
Okay, so then are there other things that people living with epilepsy should avoid, like food substances? Once I had a patient in the clinic that came and said people told me not to eat meat, not to take okra. He listed, in fact, so many nutritious things, and people asked him not to eat those things because he has a seizure disorder. And I was wondering, like, really? So are there things, be it physical like exercise or activity, up to the spectrum of food that epilepsies or people living with epilepsy should avoid?
Yeah, ideally there are no specific limitations, but it's also good to know that some things we take can affect how the drugs work. So it will not be a good idea for someone that has epilepsy to take alcohol around the time you're taking your medications. So it can affect the metabolism of the drug, so that it will now reduce the level that drug can achieve in the blood and in the brain to suppress any excitability that can lead to trigger epilepsy. But there are other things too that can, apart from food, there are things someone that have epilepsy or people that have epilepsy around them should tell them to do it regularly. Don't fast for long, because your blood sugar can drop. All these things can facilitate. Make sure you get enough sleep. Sleepless nights, fatigue can trigger a seizure.
So stress.
Stress. Make sure that you monitor and regulate your activity so that you don't, stress yourself so much. It can trigger a seizure.
So you said eating appropriately.
Then good diet.
Good diet. Because starving can mean your blood sugar could drop and you can have a seizure. and almost the other one you said
Rest.
rest, getting enough rest, enough sleep.
Enough sleep.
Stress can also be a trigger. All these are in people that already have the epilepsy. So now people that don't have the epilepsy don't go about thinking that, oh, I did not sleep last night, so tomorrow you have a seizure. So it doesn't work that way. We're talking about the triggers for people that already living with epilepsy. Yeah. Okay. So any other activity? Can they swim? Is it advisable for people that are not maybe cured? People that have not been drug-free for a certain period of time. Is it good, or is it allowed, or is it advised for them to swim, drive, operate machines, and all those things?
For those who are yet to achieve seizure freedom, it won't be advisable to go swimming unless you have a lifeguard or people around you that can intervene or something happens.
Yeah.
It's very important to know. I can remember when we went for awareness, somebody told me he lost a cousin in the village. They went to swim, he convulsed while swimming, his friends ran away, and of course he died. So for those who are yet to achieve seizure freedom, if you're doing any of these things, people have to be around you. People who know what to do.
Yes. Okay. Now you just have this exceptional way of answering questions, and you just lead me to the next thing I'm about to ask. So what I wanted to ask is this, and this is very, very important. What are we to do peradventure a family member or a friend or a colleague has this seizure? Please describe in detail things that we have to do. It's very important.
Yes, this knowledge will save lives. When somebody around you, or a child or an adult convulses, stay calm. That's the first word.
And that is the most difficult thing to do.
Stay calm.
In my secondary school, I had someone that was dealing with epilepsy. They were kids. I think I was now 10 or so. And she had a seizure before in the assembly ground. You know what assembly ground? Everybody. And everybody runs away. And everybody's afraid and we're so scared. And I honestly, now looking back, I'm wondering, how did that girl go through school? Because I don't remember her having friends. Like everybody was afraid of her. Yeah. And then we didn't know, we're just kids, but we didn't have enough information on this thing. Right now, as you're talking, I'm just wondering how she could have gone through with that secondary education back then. She wasn't in my class directly, but she was in the same arm with me, so we did almost all the classes together, almost all the levels, okay, right, but not the same class. But right now, I remember everybody running in the assembly each time she had a seizure.
That's quite sad. That's quite sad. So, stay calm. Stay calm, then start timing. I will tell you the importance of the timing.
Okay.
Then make sure that the person keep dangerous things around, keep the person safe, preferably on the floor. Preferably on the floor, you can get, if there's a soft pillow or something, you can put under the person's head so that it doesn't hit his head. Don't restrain the person.
Don't try to hold the person.
Don't try to hold the person. It doesn't stop the movement. You may even get injured or injure the person. Don't put anything in the mouth.
Oh, please tell our people spoons. But they say you should put spoons so the tongue will not, the teeth will not bite the tongue.
This paddle they used to tongue Gary.
Yes, we call it effa in my language.
Please, don't put anything in the mouth. You can dislodge the denture, you can dislodge the teeth. And at that point, you can swallow the teeth and cause even more trouble. Don't put anything in the mouth, don't put anything in the eyes. Onions, pepper,
onion, squeeze the water of onions.
Don't squeeze
and
anything. Leaves, herbal concoctions, palm kernel oil, all those things you don't need them. Don't put anything in the mouth, don't put anything in the eyes, in the anus, anywhere. Remove tight clothing, unbutton the tight clothing around the neck. Then keep the person flat on the on the floor, turned a bit to the side, preferably to the left side.
Okay.
Most seizures last less than 5 minutes.
Okay.
Most seizures last less than 5 minutes. Allow the person, the seizure will finish.
Okay.
Most of the time when the seizure finishes, the person may go into a small sleep for a while.
Okay.
But if you notice that the seizure from your timing, why it's important to keep a time to check the time frame is because if the person converses for more than 5 minutes, it's unlikely to stop on this one. So you need to bundle the child or the person to the hospital at that time, because a lot of other things can happen. Because when the child converses for a long time, the more time passes, the more unlikely the person will come out of it without intervention in the hospital.
Okay.
So keep calm, time, keep away dangerous things, loosen the clothes, do not restrain the person, do not put anything in the mouth or in the eyes or any other place. Allow the person, the seizure will, gradually finish.
Okay.
Then put the person a bit to the left side so that secretions, all those things can come out.
Okay. So, listeners, I'm sure you can hear Dr. Torti. This is very important because I know that around here, I don't know about other clients, but around here, people believe in number one, people try to force the person, squeeze the person, hold the person. They feel that as you're doing that checking will stop. What's more, they get onions. We see people come to say they put onions, squeeze onions water and put in the eye and put in the throat, or make him perceive onion water or anything harsh. Okay. Then the third one, rush and get a spoon and put in their mouth so that the person's teeth does not lock. And the person will die, or it will cut the tongue or something like that. And people come with all sorts. And then they give concoctions by mouth when this person is not conscious. Because from what you described, while having a seizure, the person is not conscious. So someone that is not conscious can't swallow. And then the thing can just go the other way, go into the airway and cause more trouble. So please, do not do any of those things. Rather, do what he said. Leave the patient, the person. Be calm. Okay, number one, be calm. 2, start timing. 3, place the person away from harmful objects on the flat surface, preferably the floor, in a left-sided position. And if you have a soft pillow, you can put it underneath the head to support the head so the person doesn't hit their head maybe while checking or what. And time. The time is of the essence, so that if the seizure does not resolve spontaneously in 5 minutes, bundle the person to the nearest hospital. And of course, if you have a phone, you can video the seizure so that when you see the doctor, you can now show the doctor this is how it looks like. Because Dr. Torti had told us that different seizures have different presentations and also have different treatments. So those are the things that you're supposed to do. No anointing oil, no palm kernel oil, no onions or pepper, whatever. Just keep it away. That's what, in fact, if you don't learn anything today on this show, please learn these basic steps and it will save your life. Do not run away from someone that has a seizure. You can't be beaten by the seizure or by the person, isn't it? Or
yes. Contact with the person is harmless.
Okay. All right, Dr. Torti, just before we go, the last question. I think even by talking, we've already dispelled most of the myths that people have. But I want you to talk about the World Epilepsy Day. I noticed a very beautiful purple t-shirt. You didn't bring any for me. It's beautiful. Please tell us about the World Epilepsy Day. You said it happened.
Yes, it's celebrated every 26th of March.
Okay.
So it fell on Sunday. So most places around the world were celebrated on Monday, and within the week, and this is part of it, to create awareness on epilepsy. It actually started in 2008 by a woman called Megan Cassidy in Canada.
Okay.
She was an epileptic, so she, having passed through a lot, having the disorder, she felt it's necessary to educate people that people should know about this neurological disorder. So it started and spread around the world. So 26th day of March.
Every year.
Every year we try to create awareness on this disorder, what it is, what is not,
Yeah.
and what people should know so that they can help
Yeah.
those who have this disorder
To live better.
to live better lives and be accepted in the society.
Yeah.
Most of the time they are denied even school enrollment, they are denied jobs, even people stigmatize their families, not marry to their families
Because they have epilepsy.
because they have epilepsy. Shouldn't be that way.
Oh my. Thank you so much, Dr. Torti. We're about to round this up. Do you have any more myths that you need to dispel so at least listeners will know? Just before we read our 5 questions for today.
Yes, having epilepsy doesn't mean that you're demon possessed.
Oh yeah, we forgot that one.
Culturally, our beliefs,
Yeah.
we have a lot of beliefs that shape our thinking on how we express and see. And we're also very strongly religious. You can pray for the person, but let the person take his medications until he's seizure free. So the person is not demon possessed. He doesn't have a good spirit or anything like that.
Thank you very much, Dr. Torti. That one was, we needed to have that as the last word. The person is not demon possessed. And before we go, I need to read out our 5 questions. We have said we're going to give out 10,000 naira worth of airtime today to 5 people that are going to answer the questions. And sadly, all my technical officers in the studio are not eligible for this quiz. So, so the 1 question would be, 1, can epilepsy be inherited? Can epilepsy be inherited? That's number 1 question. Number 2 is, what is the difference between epilepsy and convulsion? Number 3 is, can epilepsy be cured? That's number 3. Number 4 is, what are the activities to avoid if you're living with epilepsy? Are there any activities to avoid, or any foods, whatever? Just tell us to avoid. And the last but not the least is, what would you do if someone has a seizure in your presence? So you tell us the first 3 or 4 things you should do. Answers to this question are to be sent to 080 94 44 40 59 via SMS or WhatsApp. I repeat the number 080 94 44 40 59. The first answers to the question would, first correct answers, let me add, not just answer, only by SMS or WhatsApp. So I'll repeat the question. 1, can epilepsy be inherited? 2, what is the difference between epilepsy and convulsion? 3, can epilepsy be cured? 4, what are the activities to avoid if living with epilepsy? Number 5, what would you do if someone has a seizure in your presence? In other words, Dr. Torti had said all this, the answers are all what he said. So you just have to tell us what you heard. Send it by SMS or WhatsApp. Write your name and where you will send us the answers from. The first correct answers to these 5 questions, in other words, first 5 correct answers will win the money. You're not calling in with the answers. We have a call, but it's too late. Our time is fast, friends. I just confirmed he's not calling to answer the question. Dr. Torti, I want to say thank you very much for coming on the show. We really appreciate you, and we've learned a lot. Thank you so much for sharing with us your wealth of wisdom and knowledge of epilepsy.
My pleasure.
All right. So listeners, it's a wrap for today. Till same time next week when we bring you another interesting conversation. Remember that you don't have anything except you have good health. Keep it locked on 103.5 Unical Radio International, and we'll see you next week. Bye.
Unical Radio International, Entertainment 360, Edutainment 360, Infotainment 360. We smile like that.